To have a fixed denture, dental implants are necessary, but sometimes small bone addition surgeries do not allow their insertion. In such cases of severe bone atrophy, special zygomatic implants can be used. What are they, how are they inserted, and how soon can you have a fixed smile because of them? Find out in this video. Radu Nicolae, an oral and maxillofacial surgeon at Punto Bianco, will enlighten us.
What is bone atrophy and its causes? Bone atrophy is a process of destruction of bone tissue, resulting in decrease in volume, e.g., from the use of removable prostheses. Also, mechanical overload can originate from the food bolus if teeth have been absent for a longer period of time and patients have a tendency to chew their food with gums. Traumas, such as post-extraction trauma or habitual trauma, can also be causes of bone atrophy. What is a zygomatic implant? Zygomatic implants are different from classic implants, or what we also refer to as axial implants, in terms of how they attach to the bone tissue. In contrast to traditional implants that are fixed in the part of the jaw where natural teeth grow, zygomatic implants are fixed in distant bones in the zygomatic bone, thus providing us with the possibility of achieving very high stability even in conditions of very severe atrophies that would otherwise be challenging to address with conventional implants. As it is presented in the given model, in what situations are zygomatic implants indicated? Zygomatic implants are recommended in the majority of cases of severe atrophy when the placement of conventional implants is not feasible. But also bone tissue grafts that cause its growth are also extremely risky or unpredictable. One of the relative indications for zygomatic implantation is the necessity to acquire a permanent denture without delay following the implantation, which practically no augmentation in bone tissue can supply us. What are the advantages of zygomatic implants? The most important advantage of zygomatic implants is the ability to provide the patient with a fixed denture in the shortest time after the procedure. Furthermore, zygomatic implants are anchored in regions of greater bone density and stability. Due to this fact, they achieve a high level of stability at the time of insertion. However, commencing from this point, our duties and obligations arise. The doctor tasked with the insertion of zygomatic implants must be well-versed and extensively trained in the given procedure, as it takes place at a significant distance from the safest and least risky areas of the facial tissue. How is a zygomatic implantation planned? Since zygomatic implants are inserted far from the oral cavity, in order to plan such a procedure, a series of investigations are conducted. We prepare a stereolithographic model, which allows us to practice placing implants on a particular patient. Moreover, such procedures are performed under general anesthesia. The patient undergoes thorough examinations to determine how safe the intervention will be for their specific case. The anesthesiologist conducts a consultation with the patient, analyzes the tests, and after that, we can proceed to the actual intervention. However, the primary purpose of zygomatic implantation is to prosthetize the patient, and that is why we most often perform prosthetic planning before placing implants, so that the future prosthesis is comfortable for the patient and easy for them to use. Is it complicated to insert zygomatic implants as long as the hygiene is as good as possible? I believe that nothing is complicated if you are well prepared for it. From this point of view, inserting zygomatic implants can be a safe and relatively simple procedure. However, it is very important for the doctors performing them to have a rich experience, to be familiar with the anatomy of the facial complex, with the anatomical areas that are adjacent to the zygomatic complex, to be familiar with possible complications, to know how to treat them, because they are much more severe than in the case of traditional implants. Nevertheless, when we analyze the predictability of such a procedure and contrast it with alternative methods like extensive bone tissue growth procedures, we can conclude that zygomatic implantation is a less complex and more straightforward option for the patient and to a certain extent for the doctor as well, primarily because of its high level of predictability. Her results can be assessed within a short period of time. Zygomatic implantation is not highly favored among dental professionals, but if we examine the initial zygomatic implants that were inserted in the world, they were essentially inserted simultaneously with the first dental implants, and patients who underwent zygomatic implantation were satisfied. An enhancement in the quality of life for decades. At present, there are a multitude of studies conducted globally that demonstrate the high durability of zygomatic implantation and its ability to deliver long-lasting outcomes. However, it is important to mention that these results have been achieved by doctors who have been involved in zygomatic implantation for a long time, possess a rich experience in maxillofacial surgery, and are familiar with all the complications that can arise from such procedures. When can patients have permanent teeth in the case of zygomatic implants? Most frequently, in our clinic, we accomplish permanent restorations on zygomatic implants within a period of 5 to 7 days. Most frequently, in our clinic, we provide patients with a fixed work supported by zygomatic implants within a period of 5 to 7 days. In contrast to traditional axial implants inserted in the relatively soft bone of the upper jaw, zygomatic implants are inserted in the zygomatic bones of the cheek region, which are much denser, harder, and provide a higher level of stability compared to conventional implants. The overwhelming majority of cases is exceedingly high, enabling us to provide fixed dentures virtually without any exceptions whatsoever. Can zygomatic implants be inserted at any clinic in Tehran? First of all, it must be said that zygomatic implants can be inserted by specialists who are well acquainted with the area in which they are inserted. They do not insert in the area where teeth grow. Therefore, dentists with ASIC are usually not familiar with the anatomy of this area. Maxillofacial surgeons are specialists in the field of the facial skeleton, and zygomatic implants are specifically within their area of expertise and professional responsibility. In addition to the doctor's expertise, it is crucial for the clinic where the procedure takes place to be completely equipped and adequately prepared for any development of events in such interventions. We, at Punto Bianco, carry out zygomatic implant procedures strictly under general anesthesia with the assistance of an anesthesiologist who constantly monitors the patient's health status throughout the entire duration of the procedure process. Additionally, we possess a tomograph which enables us to examine the placement of the implants, assess the bone structure prior to implantation, subsequent to implantation, in order to guarantee that no errors have occurred, and if any have, they are promptly rectified. The whole clinic team must be well prepared for such interventions. That is why we, at Punto Bianco, take complete responsibility for our patients who opt for zygomatic implantation.